Do you have thyroid problem? Along with the thyroid problem, you are struggling with the long-term acidity. Yes, it is the acidity for which you keep on popping up pills, 1 every day, 2 every day, and your acidity doesn't go away. And this story is for day in, day out. Is that what you can relate to? If yes, then stay tuned with me, because today I'm going to discuss about one such hidden infection which could be lying in your digestive system, which not only gives you a long-term and a chronic acidity, but it can also be the reason for your thyroid. What's about that? Let's find out today. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, a hormone specialist doctor from Mumbai, India. Thyroid patient I see day in, day out. And one of the very common complaint they have is the acidity. And when we try to find out the cause for the acidity, one very special mention is of an infection, which we call it as a Helicobacter pylori. In short form, we call it as a HPylori or HP infection. Lot of time, a patient also wants to know, why did I get a thyroid problem? What is the root cause of that? And to their surprise, lot of times this HP infection is a hidden cause for the thyroid. What is this H. pylori? Well, H. pylori is a type of a bacteria. It is a gram-negative bacteria. Okay. Now, this gram-negative bacteria has a more than 20 species. Yes, there are more than 20 different kind of a subspecies are found of the Helicobacter pylori infection. Lot of times, patient wants to know that how frequent are these infections? Are they very common? Answer is yes, they are very, very common. In fact, in a general population, nearly 50% of the people have these HP infections hidden and lying inside their digestive system. And unfortunately, more than 80% of the people don't have any symptoms. And if at all they have symptoms, those symptoms are very vague of a long-term acidity. People can have a gastritis, people can have a heartburn, some people can have a chest pain, sometimes intolerance to many food items, or you have a indigestion issue, bloating, and the digestive system list goes on and on. So these are the very common symptoms what we see. But as I told you, 80% of the people may not even have any symptoms. And that is the reason why this H. pylori remains silent and remains unrecognized. Okay. Now, why this H. pylori infection is so resistant and it is so long term? See, unlike the other gram-negative bacteria, which usually gives you the acute infection, means you've eaten something, some bad food, this infection has come inside your body and you got the acute infection. That's a good, in fact. Your body is going to fight against it and you will be clearing this infection very soon. But that's not the case with the H. pylori. In order for the H. pylori to survive in your digestive system, it needs two important things. And both of those important parameters, H. pylori gets into the digestive system. First, it needs an acidic environment. And that's where our digestion, the system, especially the stomach, the gastric mucosa has a acidic pH. So it serves its purpose. And the second, what it needs is a low oxygen concentration. And when you have a low oxygen concentration or a hypoxic environment, this is a favorable place for H. pylori to thrive, to multiply. And that's the reason why these are the infection remains inside your digestive system, inside your stomach for a long period of time. Lot of time, people wonder, I'm living in a very well-developed country. I'm not a poor socioeconomic background. Can I still have that? Answer is yes. Unfortunately, this infection is not limited to only the socio-economic background and the developing country. It is also equally prevalent in the developed country, well, in a rich crowd. Okay. Another thing is that people often ask, how did I get this infection? Well, this infection come from any mode. It can come from a personal familial touch. It can come from even a saliva of someone who's infected, or it can be just a oral route or a fecal-oral route by the contaminated water. By any of the means, this HP infection can come inside the human body and can thrive inside your system. Lot of times when we discuss about this, the patient also get curious that if it is lying inside our system, why not our immune system doing anything for that? Well, the reason behind that is the HPylori is a very powerful in terms of the inhibiting our innate and adaptive immunity. Now, what are these two? Innate immunity is the one from which we are born. We are born with the innate immunity. And adaptive immunity happens as per the changes in our environment. The H. pylori is a powerful enough to inhibit both of this immune system, and it kind of suppresses the immune system, and that's how it thrives for months to years. Okay, and lot of time this infection is not just lying like that, it is the reason for many health problems. And since we are talking about the thyroid, it is one of the very common causative factor for the thyroid. In fact, it is also an independent risk for having a thyroid. Let's say you have only H. pylori infection in your stomach, and later on this can progress to a full-fledged thyroid problem. And when I'm talking about the thyroid problem, I'm specifically talking about the autoimmune thyroid disorders. So all the autoimmune thyroid disorders like Hashimoto thyroiditis, or another variant of that, that's a postpartum thyroiditis, or maybe Graves' disease, all these autoimmune thyroid problem can be due to a H. pylori infection. In fact, there are a lot of studies and researches has been done on the coexistence of that, and it is found that H. pylori is highly prevalent with the autoimmune thyroid problem, and it is one of the causative risk factor. Okay, the problem is not only that it causes the thyroid, but it also causes a lot of symptoms of the thyroid. So a lot of time patients with the thyroid have a lot of fatigue and the tiredness. If you check their vitamin B12 levels, they are invariably low. And why it is low? Because when you have H. pylori infection, it causes the iron deficiency anemia. It causes the megaloblastic anemia. And that's the reason why it keeps on having you the poor absorption of these vitamins. And that's where you land up with all the fatigue and the tiredness. Not only that, H. pylori, okay, this infection can also inhibit the absorption of the thyroid medicine. So the thyroid medicine which you might be taking, like levothyroxine, for it to get absorbed, it needs a certain amount of acidic environment. And due to the H. pylori infection, this environment is not sufficient enough, and that's where a person needs larger and larger doses of the thyroid medication. A lot of time patients ask, doctor, why my dose is continuously rising? And these are the people who are completely clueless that there can be some kind of an HP infection which is lying inside their body for which they are not having any symptoms, and that's what is causing them high increase in their dosage. Lot of time the medicine what you're taking is not giving you a good desired result. You will see your lab reports always bad, and your doctor will keep on rising your dosage, not knowing that it could be a H. pylori infection. So if you think that your dosage are rising continuously, don't forget to test yourself for this HP infection, very commonly found in the thyroid population. Okay, it's not only limited to thyroid. When you have a H. pylori, you are also at a higher risk of having other autoimmunes like rheumatic fever or rheumatoid arthritis. Sometimes it can also give you the type 1 diabetes, Behçet's disease, and many autoimmune health problems can happen if you have autoimmune problem of the thyroid, which could be because of the HP infection. So HP infection, very common. You need to investigate it. You need to find out. Okay. Now talking about the investigation, how will you know that you have a HP infection? Well, nowadays we have lot of tests which can support that. You can discuss with your treating physician doctor and he will help you on that. But few testings which are available, like a rapid urease test, okay, then a urea breath test is available. Then we have a stool test, okay. We also do a polymerase C reaction, okay, that is a PCR for the DNA of the HPylori, okay. Then we do endoscopy, and along with that we do the histology or the biopsy, which is done by the gastroenterologist. So there are various tests available to detect that whether you have HP infection or not. And if you have HP infection, you need to treat that. Lot of times we have seen once the HP infection is treated, antibody for against the thyroid also decreases. The Hashimoto and other autoimmune disease also can go into relapse zone, okay. And what all we do for that? There are certain antibiotics which are available which can be prescribed. Unfortunately, HP infection becomes resistant very quickly. The duration of the antibiotic needed is very long, and lot of times once you develop a resistance, the longer duration of the antibiotics you will have to take in order to eradicate this. Eradication can be a challenging, so you need to pay attention. Okay, how do we help a person who have a HP infection? There are a lot of dietary changes and certain other therapies which can help, which we do here in my clinic. So you can also include that in your protocol, and I will make another video, a home remedies which you can do in order to help your H. pylori infection. All right, what are the lifestyle changes? We will make a video on that, so stay tuned for that. But today's video is a very important to bring your notice that if you are struggling with acidity along with the thyroid, don't overlook it. Don't think that it is only because of the certain lifestyle factor or the spicy food. It can be because of this infection. And lot of time this infection is very powerful. Over a long period of time, it has a potency and a power to even give you the gastric cancer, gastric carcinoma. So if you want to protect yourself from this, get it timely checked, don't ignore it, and be alert about your health. Alright, I hope this video helps and you got some good and useful information. If you like my video, please click on the like button. And if you are new to my channel, then don't forget to subscribe. Your subscription gives me a lot of encouragement to make more such videos so that we can help each other. Alright, I hope to see you soon in our next video. Until then, you take care of yourself. Namaste.